So the next topic is HIPAA, privacy and security compliances. Okay, so this is something we are going to follow for the all the patients and patient record, and along with that, we have a set of rules which we need to maintain, which we need to follow when we are doing the coding. As a coder, this is our primary responsibility to maintain the privacy and security. So what HIPAA stands for? Health Insurance Portability and Accountability Act. This is completely enforced by HHS, that health, what is it? Health System Organization, along with that OCR, which means Office for Civil Rights. Okay, just remember this term OCR, Office for Civil Rights. Okay, so I will be providing the notes for all this as well. Okay, where you can go back and see a glance, so that when they are asking in the question, okay, they sometimes, so remember when it comes for this, especially this fourth domain, when you see O in any abbreviation, when you see O, remember it is office. Okay, that is one. 98% of the document, 98% of the abbreviations where you will have that O stands for office. Okay, so by that you can go R means right, civil. So why I'm telling this means OIG, OCR, like that you get abbreviations, so that you can remember whether it is office or any other term. But mostly for the domain 4, when the abbreviation is coming with O, remember that is going to be office. That is a small tip to remember the all these abbreviations. Okay, so here HIPAA consists primarily three important rules. One is privacy rule, security rule, then the breach notification. Okay, so what should be protected in HIPAA? What should be protected? Why we need? Main purpose, as I told, it is going to be protect the privacy of the patient information, gives the patient rights over their medical record, and sets limits for who can access or share the health information. This is going to be the main things. So protect the privacy of the patient health information, then rights to their medical records, gives patients rights. Okay, patient can access. Okay, this is a set of rule. The main rule for the HIPAA is these three important rule. Okay, so which comes under these three aspects, and I'm telling in general, we'll discuss in detail by one slide. Okay, and so as I told, gives the patient rights over their medical record, then set limits one who can access or share the health data. That is very, very important. The authentication person, the authority person only can do. What all can be protected? With the HIPAA, what all getting protected? That is the main question. What all getting protected here means patient name, address, date of birth, medical record, lab results, and payment details, and billing details, and insurance information, whether primary, secondary, tertiary. This all combinedly, we call it as informations need to be protected. Okay, so here you see, so this is what are it is getting protected. The main purpose to protect the health information. Protect the health information. It can be oral or paper or electronic, anything it can be. So what is PHI? Any information that identifies the patient related to the health condition, treatment, or payment. This is what called PHI. Protected health information. It can be any form, oral form, paper form, electronic form. What is PHI means? Any information identifies the patient and relates to the health condition, treatment, or the payment. Example, as I told, patient name, address, date of birth, medical record number, and lab results, diagnosis, insurance information, their photo, IP address, personal address, insurance information, anything it can be. Okay. HIPAA retention requirements are that certain types of document must be retained for 6 years. Okay, so especially that is the reason we always, most of the project they work with the RDP, which is remote desktop access we used to work. Why? Because if I do it in my own server, my personal server, instead of working in the client server, there is high probability for breaching my server and taking the information and distributing that information. Okay, that is the reason we do it in the RDP. In case if you're going to protect any informations, remember that protected information need to be secured with some of the passwords or some of the encryptions that need to be maintained. Along with that encryptions, we need to provide the authority who can access, who shouldn't be accessed. So that level of, we call it as granular access. So who can access, who cannot access, that need to be provided. And if you're going to store that information in encryption manner, make sure you're not maintaining more than 6 years. After 6 years, that information need to be completely eradicated. Okay, that is what HIPAA does when it comes for the privacy rule. Okay, so key privacy rule requirement. minimum necessity standards. Use or disclose only the minimum PHI necessary to accomplish the task. Example, a coder does not need access to the psychotherapy notes to assign the ICD codes. Okay, so like minimum access, what and all I can provide. Everything it is not required, right? Only minimum requirement is there. Whichever required for doing the coding is enough. It's not like all the information need to be provided. Okay, see permanent uses without authorization. PHA may be used treatment, payment, healthcare operations. Anything outside TPO typically requires a written patient authorization. So this is all the information, treatment and payment, this all which is like AR team or it is a billing team or coding team, they can share these informations. But something beyond this, we cannot share it to anybody. That is, we call it as TPO, which means that is healthcare operation, which is treatment, payment, and healthcare operations. Apart from this, any other information we cannot say. That is what a permitted uses without authorization. These three things. Then third is like patient rights. Patient have to right to access their medical records, request amendments, and request accounting of the disclosures, request restrictions, receive notice of the privacy practices. NPP, we call it as notice of the privacy practices. These are all patient has the rights. Okay, so you can do all these rights. So you can request and you can provide the access, you can restrict the access. All these things can be done by the patient when it comes for the privacy rule requirements. Then administrative safeguard, as I told, we need to have the workforce training, sanction policy, complaint process, then designated privacy officer. So we need to make sure our data is maintained by somebody in a safety manner so that nobody can breach it and nobody can misuse it. Okay, this is what the overall picture for the privacy rule. So we should be very careful. We should be very careful on maintaining the PHA information. We should know what access is there, what access should not be provided, everything. As I said, access for the medical record, requesting for the correction of the record, receive the notice for the privacy practices, request limit of the information to share, obtain the account disclosures, file the complaints of the privacy violations. These all are the set of rules, okay, privacy rules, which will ensure in the HIPAA for the PHA information. Okay, that is what the first rule is talking about. Then the next one is HIPAA security rule. Okay, what HIPAA security will do? Mainly, it will ensure it applies specifically for the EPHI information, electronically patient health information, protected information, protected information. It helps for. Okay, so what it does means it maintains the confidentiality, integrity, and availability. We call it as CIA trade. We have some rating for that. Okay, so electronically protected health informations, which is the patient information, will be need to ensure these three rules in the healthcare organization, that is confidentiality, integrity, and availability. That is very important. Okay, so if you don't maintain that, automatically we will be ending up. What type of EHI information? So you're telling some in EPHI information, what type of information it will be? It will be like EHR and EMR. You remember electronic medical report or electronic health report, those are called EPHI reports. Okay, EPHI information. Then digital lab reports, electronic billing data, emails containing the patient information, stored or transmitted to patient health information. This is all something which operates electronically. We need certain security. We need to encrypt them. We need to close them. So this applies for this hospital, clinics, insurance companies, medical billing vendors, physicians. Okay, everybody should follow the confidentiality, integrity, and availability for the EHR, EMR reports, digital lab reports, and electronically billing data. Then the email containing the patient information, or folder containing the patient information, or patient information stored in some places. Okay, all these things should be maintained under the HIPAA security policy. If we don't do that, we'll be ending up with the different risk. That is what main thing happens in the HIPAA security rule. The next one is like breaching of notification. So again, in this security rule, we have some more, like a three different steps of safeguarding. One is administrative safeguard. I will go for the breach notification next. So before that, these rules I forgot. So this is like administrative safety rules. So the administration, what they have to do, what all they have to maintain. Okay, first they have to maintain this. Employee security training should be provided. Like whatever the training we are getting every month, bi-weekly or every month we used to get an training. Okay, we call it as ISO training or internal training, or we call it as ISMS training also, like internal security and management system training. So something we maintain. So bi-weekly or monthly that will be done. Then PKT will be given for that, and we will ensure everybody is adhering to the policies, administrative safeguard policies, so that no data is getting no data is getting leaked. So that is what risk analysis and risk management, workforce security, then incident response plan, and security awareness, and contingencies plan, and information access management. These all are something like administrative safeguard. So what are all the administrative safeguard means? Yes, risk analysis and risk management they need to provide. Okay, so like if I'm using any software, whether I'm able to access outside or only in the organization, that analysis need to be provided, that risk analysis. And if it is able to provide able to access outside, whether I can able to control or how much the risk will be there. So we call it as a risk asset, we call it as, okay, risk assessment or risk asset. So that need to be maintained. Workforce security, so if load is more, if load is less, how I'm going to maintain. Information access management, which is who has to get this information, who has not to get that information. Security awareness training, yes, the training need to be provided, how to carry the information, how to transfer the information. This all need to be done. Contingencies plan, in case the information is gone out, how I'm going to keep it in control. Okay, this all comes under the administration safeguard. Then next, if you see physical safeguard, physical safeguard means we can tell this locker room, that one example we can tell. Then there's access card, whatever they're providing, that also we can tell. And securing the workstation, if you see, our workstation will be protected with some biometry. Okay, and when you're disposing something, any physical things like paper or something like that, or any hardware, something like that, we need a proper instrument, we need a proper machine to, which we call it as discarding machine. Those and all we need, disposal machine or discarding machine. So locking the server rooms, batch control access, then securing the workstation placement, and device disposals, okay, and media controls, workstation security. So much we can tell. Just imagine, just remember your physical security which you have around your office, so that you can remember all those things. Then technical safeguard, here technical safeguard which will tell you unique ID card. Yes, everybody will not have the common ID card. Unique ID card will be there. Password protection, encryption, audit controls, automation log off, then transmission of the security. So this all comes under the technical safeguard. So administrative safeguard, physical safeguard, technical safeguard. See, there is a chances where they may ask the questions related to this, asking that which is which are comes under the HIPAA security rule. And if they would ask in deeper means what are the physical safeguard, and they will give some four options. Okay, so try to I know it is going to be a little difficult to remember, but if you put your logical mind even in this situation, yes, you can bring it to that segregation also, because you know what is the outer layer. When you know outer layer, automatically you can understand what is inside also. Okay, so read the question one or two time, read the option one or two time, eliminate the incorrect answer. So I will be telling you when you are taking the test, when you are giving the feedback for that, I will tell you to how to eradicate the incorrect answer, and how to choose the best answer, how to choose the best 50% of the answer, how to eradicate remaining 50% of the answer, how to make sure, like by using the books, by using the data whatever we have, by keeping that, how can I can mitigate the incorrect answer. These are all things I will be telling you step by step when you are going to take the mock exams, all those things. But before that, I need you wanted to complete the practice exams. Okay. Then breach notification rule. Nothing. Breach means an unauthorization acquisition of or use of disclosure of the patient information. That is what we call it as breach notification. Okay. So the main purpose of this breach notification rule is to maintain the patient information, their health information, like accessing improperly, stolen or lost or disclosed without unauthorized person. These all will be the main scenarios, main purpose. So that is what, to keep that in the control, we have this breach notification rule. Okay, so it is like we can tell, like we have to immensely, this rule need to be disclosed to protect the PHI. Not only PHI, even the EPHI we need to protect. Okay, so we cannot compromise here the security or privacy information when it comes for the breach notification rule. So we need to ensure our informations are always getting encrypted, or once it is used, that is getting destroyed. These all things we need to be make sure, we need to make sure we are maintaining this. Okay, so for that we require certain things. Okay, so when the breach is happening, this need to be notified to the healthcare provider. Health plans need to be provided for that, and clearinghouse need to be informed. and the business associates need to be informed. Okay, higher managements need to be informed. Okay, so when the breach is happening, we have to follow all this rule. So the rule, the main and three rule is like notify affected individuals within 60 days, notify to the HHS, and notify media if greater than 30, 500 plus individuals are affected. There may be the question when the breach notification will be informed to the HHSI. They may ask like that, or when the breach notification rule need to be informed to the media. More than 500 people are getting affected. Okay, then they may ask you what are the breach notifications, what are the breach notification rules, okay, which are like stolen, lost, or disclosed without authorization and accessed improperly. These all are the breach notification rule. Okay, so try to remember this kind of point so that you will be able to understand. So in the IPA privacy and security policy, we have three important. One is the privacy rule, security rule, and breach notification rule. In privacy rule, we have the set of elements which need to be followed. Those are minimum necessary standards, permanent use of the permit the use of the without authorization, patient rights, and administrative safeguard. Here is one administrative safeguard in the privacy. Same way, the security rule also we have one administrative safeguard. Here it is going to protect, okay, patient information, and here also it is going to protect the patient information. Here it will be the set of rules. Okay, here it is going to be followed with some of the policies and guidelines. Okay, so make sure you are able to differentiate that so that we don't get confused in that situation also. Don't worry, I will provide you the notes also. You can see the glance, you can see the video one more time also. Okay.
Okay, sir.
So this is what happens with the HIPAA when it comes for the HIPAA privacy and the compliance rule. Okay. So we'll go for the next